Good evening once again, everyone. My name is Adewonyi. I'll be the anchor for tonight, and I'm sure we are all excited to be here this evening. So this evening we have a presentation, and I'm sure we are all ready and we are all good to go. So I will be talking about patient advocacy and empowerment in surgical care, and is one of the key area in surgical practice as well. So tonight, I'm going to just read brief history of our presenter. Our presenter is her name is Nurse Aye Debinu Olushola Abiodun. Um, she was the Deputy Director of Nursing Service and pioneer head of unit theatre and endoscopy unit at Obafemi Awolowo University Hospital in Ile-Ife, Osun State, Nigeria, before her retirement in December 2022. Currently, she's now serving as a clinical instructor at the School of Post-Basic Nursing, School of Perioperative Nursing at the same hospital. She started working in OAUTHC operating theatre from 1992 to 1997. Then endoscopy unit from 1997 till date. She completed her nursing school at 70 School of Nursing 1982 to 1985. Then School of Midwifery OAUTHC 1987 to 1988. She had her post-basic perioperative nursing in OAUTCH between the year 1996 to 1997. She had endoscopy training between the period of March to June 2008 and National Open University of Nigeria, Ibadan, 2006-2012. I guess that's for our Bachelor of Nursing Science. She has extensive international and national experience, international observation, working experience at John Hopkins Hospital Endoscopy Unit. That was Maryland in United States of America in 2015, and at Beth Israel Dickinson Memorial Center, and same in the United States of America in 2018. So our presenter tonight has a passion for endoscopy with an interest in gastroenterology. She has presented in many perioperative and endoscopy seminars, a teacher of excellence to many students, nurse, perioperative, and medical students. She is also a member of the Society of Gastroenterology Nurses and Associates, SGNA, United States of America, then SOGANON, and NAPON, Nigeria. So I present to you Nurse Ayede Binu as our presenter tonight. Can we give a round of applause by welcoming our presenter?
You're welcome, Ma. We're happy to have you.
Thank you. Good evening.
Floor, ma.
Thank you very much. Good evening to all the participants from all over the world. The topic to be presented this evening is patient advocacy and empowerment in surgical care. These are my outline. Introduction, keywords, reasons for patient advocacy and empowerment in surgical care, components of advocacy and empowerment in surgical care, benefits of patient advocacy and empowerment, nurses' role, advocacy, and empowering surgical patients. Conclusions, introduction. Awareness of the critical role advocacy and empowerment plays in promoting safe clinical practice is on the increase with the current realities. That is, people are now becoming aware that advocacy and empowerment is necessary in clinical practices. The registered nurses described patient advocacy as promoting patient safety and provision of quality care. Nsaya et al., 2019. Studies have indicated that the absence of patient advocacy has negative consequences, still by the same author. Patients suffer complications and die in hospitals, not because of their sickness, but rather as a result, health professionals' refusal to attend to the patients in time. We are all aware of different cases now where patients have been refused to be cared for in the hospital. Norman et al., 2012. Complaints of impolite treatment and disrespectful attitudes towards patients by hospital staff, including nurses, suggest a need for patient advocacy. Abeka Nkrumah et al., 2010. Patients are offered assistance and guidance through a healthcare system where they get information needed to make informed decisions which best fits their needs about their health care. We see the importance of advocacy and empowerment here. If the patient is well informed, they will know what to do and when to seek for health care and where to go. Empowerment can be described as an inner strength that arises from a client's relationship with another human being, where he gains knowledge that generates positive force within himself, which entails the possibility of self-determination, Walling, 2017. Lack of empowerment makes patient becomes powerless and helpless and experiences a loss of control. If they don't know, they cannot do what they don't know. It's like giving what you do not have. If patients lack empowerment, they become powerless. Now, there are some key words in this presentation. Patients. A person receiving or registers to receive medical treatment. Advocacy means getting support from another person to help you express your views and wishes and help you stand up for your rights. Another meaning of advocacy, helping people to find their voice. What is empowerment? Empowerment, this is preparing people to take control. Then surgical care, care that provides operative procedure, especially surgeries, for the correction of deformities and defects, repairs of injuries, and diagnosis and care of certain diseases. Now, what are the reasons for patients' advocacy and empowerment in surgical care? Why? Why do we advocate for our patients and why do we empower our surgical care patients? The following are the reasons. To provide patients and caregivers with the support and education they need so as to make their own decisions about their next steps. The key thing here is knowledge and education. When you educate the patients and the caregivers, they catch what you give them easily and will make use of it from time to time. To make clients' journey through the healthcare system as smooth as possible. Let me support this point with an example. For example, in OAUTAC, Obafemi Awolowo University Teaching Hospital, Ile-Ife, where I was working before my retirement, we have about 4 phases there. Phase 1, phase 2, phase 3, phase 4. And initially, we used to have one pay point in the whole hospital. So if a patient is admitted in phase 4, the relations of the patient himself, maybe ambulatory case, must get to phase 1 before payment. If you are in phase 3, you must get to phase 1 before payment. So as a sort of advocating for our patients, some groups have to sit down and have a meeting that we must have different pay points in different areas. And to the glory of God, it has been achieved. And this one has helped our patients to have a smooth journey when they come to the hospital. When you visit a doctor in phase 1, you pay phase 1. If it is phase 2, you pay in phase 2. Just like we have been doing in other phases now. Patient advocacy and empowerment in the operating room can save lives, though it can be complex and challenging. Because you as a surgical care nurse, you must be functioning, all your systems must be functioning when you have a patient to be operated upon. You want to make sure the patient is well laid on the operating table in anatomical position. If the patient is not placed properly, it might result into different types of problem after the surgery. The least of it is paralysis of some areas that are not well positioned on the table. And all other functions of yours must be functioning. Like you are not an anesthetist, but we have multi-parameter patient monitor in almost all the standard theaters. You want to fix your eyes on it as you are working. In case of any deviation, you can quickly call the attention of the anesthetist to it, though it is their primary assignment. Patient advocacy is also important during surgery when patients are under anesthesia, leaving them vulnerable and unable to make decisions for themselves. You know, when a patient is under anesthesia, what can the patient see? Patient cannot see, patient cannot talk, patient cannot defend him or herself. Now, components of advocacy and empowerment in surgical care. Advocacy, components of advocacy. Communication skills. As an advocate, you must be able to communicate very well. You must be able to speak well. You must have active listening ear. Because if you cannot communicate well, how can you advocate for the patient? No, you may not be able to advocate well for the patient. Knowledge of rights. You must be knowledgeable about the different types of rights that the patient is supposed to have. Right to eat, right to be cared for, right to take drugs, right to refuse, and right to really bring out what they have on them. They must not be shut down. So you must know all the rights that the patient must be exposed to. To ensure safe surgical practice, if you advocate well, the patient will be safe while receiving surgical care. Ensuring is done throughout the care. We know as nurses, we must bridge the gap of care because our patients must not sustain any injury, be it minor or major. The patient is under our care. A voice for them when they cannot do it themselves. That is our primary assignment. We must not wait till our patient is harmed before we talk. We must not wait for our patient to go into shock before we do what we are supposed to do for the patient. Because doing CPR will be costly rather than observing that the patient is sweating and we know what to do as a quick response. Components of empowerment. Educating patients to make their own informed decision. When they are well educated, they will be well informed, and they will be encouraged to take their own decision. Once you are giving them the power, they have the trust in you. If you are a nurse and you are speaking to them, all what they will believe you, and they will make the best use of it. Treat them as an individual. That is the essence of our nursing process. You don't lump them together when you want to empower them. You treat them as an individual while you are dishing out your empowerment. Active listening. You must not be in a hurry when you want to empower, because as you are giving out the information, they will want to make and seek for clarification. The reason why you must be gentle when you want to listen to, you must not be in a hurry. You must show them you are patient to really listen to them. Instill courage and boldness in them. When you are talking to them, make sure the courage is being given to them. When you do this, this is the outcome. When you do this, this is the outcome. You really instill the courage and boldness in them. Then building trust. You know, some patients, when they come for surgical care and you talk to them, you build the trust that this thing you are coming for, this is how it's going to be, with examples, positive examples, not negative one. When you give them and you build this trust in them, you know they are good to go. But when you trust, make sure what you tell them is what you are still going to repeat. Not that in the morning you will tell them this, in the afternoon you will come and say another thing. You know our patients, they really fancy nurses that really tell them the correct information. What are the benefits of patients' advocacy and empowerment? Now to surgical patients. Studies had concluded that patient advocacy saved lives, and we all know that. Helps to maintain good health, ensure caring and quality care of patients, quick recovery, and minimize burdens on the healthcare system. Nsaya et al. 2019. Advocacy helped the surgical patients make informed decisions about their health because you have really educated them. Bridging communication gap between healthcare professionals and patients. The gap between the healthcare professionals are bringing the gap to a close, because in the past, you know, the awareness of not coming together to discuss about a patient is not there. But now, as a surgical patient, the surgeon, the anesthetist, the scrub nurse, everybody will come together to have a meeting about the way out of the surgical patients they want to put on the table. So this bridge communication gap. Improve health outcomes, yes. Create lasting connection between health professionals and patients. Encourage evidence-based education, as simple education can save countless lives. We will all see that education is important. Education is power. Once you give out the education, it saves a lot of lives, rather than keeping the education under our cloth or under the table. Provides care for patients beyond the treatment within facilities. At least when the patients are going home, advice discharge is so useful to them, so that when they leave the hospital facilities and when they get home, they will continue to be doing what they are instructed to do. Then we carry their families and other caregivers along. Then it ensures equal health care access for all, meaning everybody has equal access to health care. Not that some certain set of people should be cared for and some should not be cared for. It ensures equal health care access for all. Advocacy Network 2020 revealed that patient empowerment assists the patient in the following areas: the right to use their own strengths and master the situation. Right to self-determination, that is, the patient decides over his or her body, which means that the patient retains his or her dignity, that it is not all the time that it is doctor that will decide for the patient. This is what you are supposed to do. This is what you are supposed to do. It is not the nurse that will tell the patient all the time, this is what you are supposed to do. Once they have been empowered, they can take over the decision of what to do with their body by retaining their dignity. The patient experiences a trustful atmosphere where the patient and the nurse can meet, thus enhances patient experience, meaning we must be closer to our patients, and that trust instilled in them must be demonstrated. By empowering patients to take co-responsibility for the management of their condition, it may not only enhance medical outcomes, but also lowers the cost. When they know when to come to the hospital or when they are supposed to seek for medical care, they will come on time, rather than when the problem has overstayed and it has reached another peak before they start coming to the hospital. For example, a woman that has lump in the breast, through education, we all know the normal breast must not have lump. But once they are well educated, when they sense or they feel lump in their breast, they know where to seek for medical attention. And once they come to the hospital on time, it lowers the cost, rather than leaving the breast lump to grow into cancer before coming to the hospital. We will all know that when we are treating a benign breast lump, there is lower of cost rather than when it has grown up to breast cancer. Empowerment increases patients' ability to act on issues they feel are important to their health care. If you have empowered them, they know that when they come to the hospital as quick as ever, their problem will be limited. Empowered patients is confident in their ability to manage their health condition. When unsure about where to go or what to do next, they feel confident to ask questions from healthcare professionals providing their care. Some of them do have the surgical care nurse, their phone number, that even when they are not in the hospital premises, they can give a call to discuss about their health. Now, what are the benefits to the nurse? Patients' advocacy and empowerment decrease the nurse's workload, thereby improve the nurse image. Once you have advocated for your patients and you empowered your patients, you will feel fulfilled and you will feel comfortable. It is not all the time you will now be saying that thing all over and all over again. Nurses, other healthcare workers, and their expertise are trusted to keep clients safe during a very vulnerable experience. Confidence is built in nurses of their important role in gaining trust and protecting their rights. As nurses, the confidence is in us. When we have empowered our patients and we have advocated for our patients, we feel fulfilled, and the pride will be in us that we have done what we're supposed to do. BAC 2020 suggests that nurses feel confident, comfortable, and supported while advocating for patients in challenging situations. When we are doing it, we are proud of doing it, and it makes us with a culture of safety in mind. Here are some ways nurses can be a strong advocate and empower surgical patients undergoing surgeries. Always do a thorough surgical timeout. I'm not very sure whether it is in all theaters that surgical timeout is being done. There are approximately 40 to 60 wrong size surgeries per week, UCTH 2020. Wrong size surgeries are preventable, and timeout can help reduce this occurrence. I always wonder when I read about this in dailies and on social media that are wrong side surgery. I always feel, why should there be a wrong side surgery? After all, the patient has gone through assessment before they decide the patient will do surgery. And this surgery timeout has really helped because we do surgical timeout in OAUTC Ile-Ife. And during surgical timeout, you know, it is not a thing you will do while you are silent. Be loud about it. You start introducing, you introduce the surgeon, scrub nurse, circulating nurse, the anesthetist. Then you go to the surgical. Now you want to do mastectomy, and the site of the mastectomy is the breast. The surgery is to take place on the left breast. I believe somebody within the operating room will be there to make a quick correction. So it's always surprising to me when I read about of this discussion. Having a voice for them when they cannot speak themselves, and ensuring harm is done through safe nursing practices in the pre, intra, and post-surgical intervention. Our patients' safety must be our watchword, the reason why they are in our hands. Quick response to patients' concerns. This instills trust and confidence in the organization and creates a sense of responsibility to remain vigilant about voice concern. Must be able to respond we don't wait for to before we make a quick. Care for your patient as you would care for your family. We all know the love family. So when patient is in our environment, they should be cared for as if they are one of our family. This one relates to the growing others. Like, if nurses can keep this in the forefront of their mind, they can come from a genuine place, empathetic care. Effective team communication. We all know the importance of communication. We know the importance of collaboration. We all know the importance of teamwork. There's a break in communication. There's a breakdown in patient safety. And that is what wants to happen. There shouldn't be any breakdown in patient safety. Clear and concise communication involving all members of the surgical team improve patient outcome when we all speak with one voice as we are caring for our surgical patients. Effective team communication involves adequate planning and for each surgical case through interdisciplinary discussion. You know, some surgeons, it is when the patient is on the table that they are seeing the patient for the first time. I think that one has become a thing of the past now. Through team communication, we'll be able to plan very well, and patient will be prepared, and the surgical case outcome will be positive. As case we have, nurses are experts who can navigate the complex healthcare system. You know, the nurses are there for them 24/7. It is nurses the patient will see in the morning, afternoon. So we are really being help patients to navigate any issue that else. If you agree with the because it is not all the time. They want to go by what you are telling them, but you as an advocate are there to really speak their behalf. Conclusion: advocacy and empowerment in surgical care is an integral in the achievement of patient safety and rights. Drives acts of pleading for, that is, when you are pleading for your patients, please, let's do this for this patient, let's do this, let's do that. Supporting an active exposure of one client. The patient's wishes often serve as impetus for and empowerment. Their wishes are always the first thing, and their wishes are always on our mind. Surgical patients are well informed through education, which affects that lead them to where and when to seek for attention. That is, if they are well informed through empowerment, they will know where to seek for medical attention. Nurses function to advocate, empower, and accept responsibility to safeguard the rights of medical patients. Nurses view empowerment as an important component in their practice. Yet, this should not be professional obligation in their requirements and resources. That is, it is to be part of daily output, part of our daily and empowerment. When we do it, Well, it's not a professional obligation. It is what we should put in our practices. And we should be doing it every day as we carry out care. Where a nurse will be and the nurse refuse to the surgical clients, it is as equally good the nurse is not there. Not that we should wait till our patients are injured before we start making calls, before we start. These are my references, and I say thank you to all for listening.
For that wonderful and powerful section. You can mute yourself to say thank you. So as we're doing that, time is not on our side. We move on to the WhatsApp platform for a question and answer, clarification, and if there's any contribution. So our presenter will still be on WhatsApp group to attend to our question and answer if we have any, or if we have any clarification. Thank you, everyone. And we meet on the WhatsApp platform.
Well done, my beautiful presentation. That was loaded and very insightful. We really appreciate all the efforts put into that presentation. We will definitely bring you back for another one if it's okay with you. Thank you so much, Ma. That was brilliant. Well done and well done. Thank you.
Thank you. Thank you.
Yeah, we go to WhatsApp then. Yeah.
All right, thank you.
I'll let